cancer is an intense diagnosis. It changes a patient's life. And I find that it's very rewarding to care for a patient during such a difficult time. A very close relationship can develop over a short period of time. I'm a thoracic oncologist, so I care for patients with lung cancer, and I research better ways of treating and understanding lung cancer. So when I was a fellow in 2010, I received a Young Investigator Award from the Conquer Cancer Foundation. And then just this year, I'm lucky to have received a Career Development Award from the Conquer Cancer Foundation. The first award was to study EGFR mutant lung cancer and resistance and sensitivity to a treatment called erlotinib. We found that when patients receive erlotinib after surgery in attempts of curing their cancer, sometimes they recur. And when they recur, they did not harbor a resistance mutation and were able to receive erlotinib again and gain further benefit from the drug. And what that tells us is that resistance is a transient thing, that resistance can come and can go. And erlotinib continues to be an important part of their treatment at multiple parts of their care. It also taught us about the T790M mutation, which is this resistance mutation that develops in about 50% of patients. This then led to our questions with the Career Development Award. About 1 in 1,000 lung cancers, when they're diagnosed, carry this T790M mutation, and we asked, why is that? And our hypothesis was, the reason it occurs in the patient is not because it's in the cancer, but it's because it's in the patient's genes. It is the reason why that patient developed lung cancer in the first place. So with this Career Development Award, over the next 3 years, we're working as a cooperative group to try to find these rare patients and study them and study their families to understand why does lung cancer happen in them and understand a disease that was previously too rare to study on your own. This refocuses inherited lung cancer research away from studying all patients with lung cancer, many of whom who smoked, into now studying non-smokers. Why does lung cancer happen in non-smokers? On its own, lung cancer in non-smokers is the 7th most common cancer worldwide. And yet, it's sort of lumped in with the rest of lung cancer. We're trying to separate that out, find those families who suffer from lung cancer in non-smokers and understand their risk. Why does lung cancer happen in them? And hopefully discover how to prevent that kind of lung cancer. In the end, the most rewarding thing that I do is care for cancer patients. Sometimes I'll meet a patient for just 60 minutes. They'll drive in from hours away and they have to go back to get care from their local oncologist. But during those 60 minutes, I find it's my responsibility to try to change their experience of their cancer, to help them live as well as possible, to help them find the treatments that will change their disease. And to be able to do that day after day for vulnerable patient after vulnerable patient is profoundly humbling.